The idea of prosecuting mothers for substance abuse that could affect their babies is supported by our guest in Chicago. There, Barbara Harris is a foster parent who works with newborns exposed to illegal drugs. Ms. Harris, good morning.
Good morning.
Why are you so adamant in your belief that expectant mothers who abuse drugs or alcohol should be held accountable by law?
Because I believe that a woman should be held accountable for what she does during her pregnancy. I know that 800,000 drug-addicted babies were born last year, and that was what led me to seek legislation in California to get a bill that's presently been written, and it's going to be brought forward in January, and hopefully if it passes it will make giving birth to a drug baby a crime.
But if we accept the fact that alcoholism and drug abuse are diseases, how do you then make the leap to prosecuting someone for being sick?
Because I believe that alcoholism and drug abuse are a disease of choice, and the children have no choice. The 4 children that I adopted are 4 of 8 that one mother has given birth to, and they were all born drug addicted, and it's her choice to use drugs, and it wasn't their choice.
Do you honestly think prosecution would prove an effective deterrent?
Yes, I believe that at least it would force these women into rehab centers. Presently, there's nothing being done. The women just go into the hospital, give birth, they detain their baby, and the woman goes back out on the street and uses drugs again and usually gets pregnant again in a very short amount of time. And at least if we prosecuted them and forced them into drug treatment centers or into hospitals, into jail, where they have drug treatment programs, it's possible that a few of them could get clean.
Let me get a second and conflicting opinion from Lynn Paltrow. She's with me here in New York as Director for Special Litigations at the Center for Reproductive Law and Policy. She has defended many women accused of endangering the lives of their unborn babies. Ms. Paltrow, good morning.
Good morning.
What do you suggest would be the short and long-term effects of prosecuting those who endanger their babies with abuse problems?
Well, I think Barbara Harris and I agree that women need to be accountable and that we want to see women not use drugs during their pregnancy, but we disagree in approach. And I agree with the March of Dimes and the American Academy of Pediatrics, groups solely concerned with the health of children. And what the March of Dimes says, and the other medical groups, that threatening jail will deter women from seeking prenatal care and drug treatment, putting women in jail where there usually is no drug treatment, but there are drugs, and they are notoriously bad in terms of providing prenatal care. Miscarriages happen all the time in jails because health care is so bad that you're going to hurt more children.
But when others, outsiders, doctors and the like, are held accountable for the extent to which they may threaten an unborn child, why shouldn't the mother be held legally accountable?
Well, there's a difference between holding somebody morally accountable. Once a woman's addicted,
I'm talking about legally accountable.
Right. But do you want to have healthy children, or do you want to feel better? In other words, people are going to feel like something's been done if women are put in jail. But what you want to do is get women into treatment. The Republican Congress has cut drug treatment money. The people who are hardest hit are, guess who? Women and children. And in California, they have cut 5 programs for women and children. It's not about using jail to get women into treatment. We need treatment to get women into treatment.
But assuming we can't get those women into treatment, should society just ignore these disturbing numbers of drug-addicted babies and those with alcohol problems?
Absolutely not. It's so important that people understand the problem, but you can't encourage women to go to treatment if none exists or if it's being cut rampantly by our Congress. So the notion that you need jail to get women into treatment when women are begging to get into treatment, when the medical groups say if you want healthy children, if you want to encourage women to go to treatment, don't tell them that their doctors are going to be police informers. Don't tell them if you admit you have a problem, you're going to jail. Tell them we have a treatment program for you. But that's not what happens in America.
Ms. Harris, why do you suppose most major medical associations in this country are against criminal prosecution for pregnant women with substance problems?
I can't imagine why anybody would be against it. And in response to what Lynn said, she's under the assumption that these women are looking for treatment. A very small percentage of these women are looking for a treatment program. We have treatment programs in California, and social workers offer these women lists of programs, 20 or 30 resources when they give birth. And if a woman's not looking for a treatment program, then how are you going to get her in one?
Well, I'm not sure what your sources are, but I've talked to many national experts, drug treatment people. In California alone, 5 leading programs for drug-addicted pregnant women are being cut. Their federal funds are being cut. Every program I have talked to has waiting lists. And when and I'm in a pretty privileged position, have tried to get my clients into treatment, they have stayed in jail, which costs the taxpayer far more money than treatment. So it's just not out there.
Okay, but there are programs, and that's not what I'm saying. The programs that exist, the women are not looking for. The mother of the children that I have has given birth 8 times, and she's never looked for a drug program. We have women in California that have had as many as 24 drug-addicted babies.
I appreciate your personal experience, and that's important to hear. But the typical pregnant, addicted woman is a white woman in her 30s who's divorced, who's using alcohol and another drug, and only has 2 or 3 children. We're talking about women who have a serious health problem that needs to be dealt with through the health system, not through throwing them in jail, which costs, for example, in a 10-year sentence, would cost the taxpayers $180,000 to keep that woman in jail.
How much do you think it's costing taxpayers to take care of the babies that are born? We spend billions. We spent $800 billion last year on medical expenses for these babies.
Right, and we know that treatment works, and it decreases health problems. So what we want to do is work together.
The treatment's not going to work if we don't get the women in the treatment programs. You're assuming every woman that's a drug addict is looking for treatment. They're not. They're not. A small percentage are looking to get off drugs.
Ladies, I'm going to have to call a halt to it. I thank you both very much for giving us both sides of it. Barbara Harris in Chicago, thank you. Lynn Paltrow here in New York, thank you. We're going to take a break here. Coming up on 22 minutes past the hour, and this is Today on NBC.